And when I think about AI doing a human task, I don't necessarily think it's going to do it better in all dimensions. I think of it in terms of one of four, either speed, scale, scope, or sophistication. And you hit on, I think, all of those in how AI is being used in medicine. Sometimes it's not better than a human doctor, but it's faster, and speed is more important. It's sometimes the scale. We just don't have a doctor in all of these locations. So an AI maybe is a poor replacement for a doctor, but it's a great replacement for no doctor. There's the scope, the fact that the AI could know more than any particular doctor. Then the sophistication. In some cases, the AI can make a more sophisticated diagnosis than a human can, like reading a test result. And sort of interesting to watch those interplay as we look at AI either replacing or augmenting humans.
Bruce, what you just said is totally spot on. I hadn't thought about considering the uses of AI in quite this way, but I think we have to consider that AI is a tool. And therefore, as with any tool, there are reasons why we're using it. We have to be clear about our objectives. We have to understand also the limitations and the potential risks of the tools that we're using as well. And I very much appreciated what you said about AI. And if we're using it specifically for scale, maybe we recognize that the downside is it's not as accurate as the ideal clinician, but it's better than no clinician at all. And I think similarly, in the case of rare diseases, I've also spoken with patient advocates and researchers in this space who are saying, look, the average physician, even a great clinician, isn't possibly going to know all the manifestations of every disease that could possibly exist out there. And in these cases, AI can be a really valuable second opinion of sorts. Often these are patients who got their diagnosis through AI. They then brought it up to their clinician who said, wow, I never heard about this before. Let's look it up together. And so I think that humility is also what's necessary of our clinicians nowadays. I think the ones who are going to be really successful in incorporating AI, because they can see it not as a threat, not as a menace, not as a replacement for them and their skills, but as an enhancement.